Now that we have talked about chronic kidney disease and stages, in phase 2 of this class, we are going to talk about what is kidney failure and end-stage kidney disease. End-stage kidney disease means a person with chronic kidney disease requires something else to make sure that they can live healthily, which means the kidneys have reached end stage, or we sometimes also call it kidney failure. That doesn't have to stop completely. Patient can be making urine, but the function is so low that a person requires a treatment which replaces some of the kidney function. Hence, we call it kidney replacement therapies. So, how do we provide kidney replacement therapy? Well, there are 3 types of kidney replacement therapy. The best thing, if the person is eligible, is to receive a kidney transplant. Unfortunately, we do not have enough kidneys available to put in every person who develops kidney failure. Hence, most people with kidney failure require cleaning of blood. We call it dialysis therapy. And then finally, some people who have many other medical problems sometimes choose that they do not want to receive any dialysis or kidney transplantation and may receive conservative care. Before I go forward, let me say a few words about conservative care. Usually, people who are elderly and have many medical problems many a time feel that doing dialysis may be quite cumbersome or exhaustive for their life. Many of these people can choose not to receive dialysis. Dialysis with significant medical burden sometimes is not tolerated well. Thus, if you feel that you have any of such situation and want to talk more about conservative care, please let your educator know at the end of the session, and you will need to discuss this with your primary care physician further. From this point onward, let's talk more about different types of dialysis and how you can choose the best for yourself. Before I go further, let me tell you what dialysis is. The picture here shows a representation of your blood or body. If you imagine your body to be this tank, on the left-hand side you can see the tank is full of toxins. Dialysis means cleaning blood, which means after dialysis, on the right-hand side you can see the toxin level have gone down. It does not go away completely, it just goes down. The second thing I want you to know about dialysis is how usually dialysis is started. So, most people start dialysis when they have stage 5 or less than 15% kidney function. But not all patients with stage 5 are on dialysis, which means on an average, by the time a person needs to start dialysis, their kidney function is much lower. Usually about 5 to 10% kidney function, or EGFR of 5 to 10. So how do we start, or how do we decide to start dialysis? Well, I have 2 simple suggestions for you. Sometimes along your kidney disease, you may feel that your medical problem and symptoms are just far too many. If that is the case, you as a patient can tell your doctor to consider starting dialysis. The other time we start dialysis is when we as providers, doctors and nurses, see your laboratory values, examine you, and feel that you may not be safe without dialysis at home. That's when we will tell you that your toxin levels are too high and you need to start dialysis. Here I'm showing you some of the common reasons people start dialysis. By far, couple of most frequent reasons to start dialysis is having too much fluid in the body, lots of swelling, feeling short of breath, or uncontrolled blood pressure. The other common reason is that your potassium values are very high. The remaining type of Example shown here: extreme fatigue, a lot of itching, poor appetite. These usually come either by themselves in a severe manner or together and combine to make you feel sometimes not so well. And then you will tell us, hey doc, we need to start dialysis. I'm going to stop here for my second pause and let you talk about what is end-stage kidney disease and when one needs to start dialysis with your educator. Some of these questions, like before, you will go through with your educator.